Amyloodinium ocellatum is the agent responsible for marine velvet disease, also known as oodinosis. This is a dinoflagellate. It's a parasitic protozoan with a tropism for the lamellar epithelium, the epidermis, and the cornea. Outbreaks are often associated with elevated temperatures. In regards to epidemiology, the parasite has a triphasic life cycle, involving the trophont, which is the attached feeding stage, the tomont, which is the rapidly dividing encysted stage, and the dinospore, which is the motile infectious stage. Transmission is direct. All species of teleost and elasmobranch within the marine environment are susceptible to infection. The parasite can be identified on gill clips. The image to the right is an example of what you might find in a gill clip. Notice the trophonts and dividing tomonts, as well as the focus of telangiectasia. Clinical signs associated with this disease include inappetence, respiratory distress, and lethargy. On gross examination, the gill filaments are thickened. There may be excess mucus production and red stippling. Other lesions include white stippling of the skin in the case of epidermal infections. Histologically, there's an abundance of interlamellar dinoflagellates. Affected filaments are inflamed, with associated lamellar epithelial hyperplasia and lamellar fusion. The images to the right are an example of an epidermal infection. Notice the fine white dusting. There's also mild clouding of the cornea. Within sections of the gill, there's patchy lamellar epithelial hyperplasia with associated lamellar fusion. Scattered between the affected lamella are large numbers of dinoflagellates exhibiting various life stages. The life stage in section is a trophont, which is attached to the lamellar epithelium by a rhizoid. This is highlighted by the arrow. In other areas, there are scattered tomonts within pseudocysts, which form as a result of the partial fusion of adjacent lamellae. One of the tomonts is in the process of dividing to produce the motile dinospores. This is labeled in red. Piscinoodinium pillulare is the freshwater counterpart of marine velvet disease. The image to the bottom left is an example of an epidermal infection. Notice the fine yellow dusting all over the skin. The image on the right is a sketch of a trophont, which is the attached feeding stage. The parasite latches onto the skin using a rhizoid, which is the anchoring structure marked with the letter H. Gill lesions noted on gross examination include thickened gill filaments and increased mucus production. The image on the top right is a gill clip with large numbers of parasites between gill lamellae. The same gill is seen in section in the bottom two images. Large numbers of trophonts are seen latching onto the lamellar epithelium. The rhizoid is highlighted by the black arrow in the bottom right image. Saprolegniasis is a disease caused by oomycete infection. Species include Saprolegnia, Aclea, and Aphanomyces. Oomycetes are water molds, they're not true fungi. Some of the species are opportunistic pathogens, others are primary pathogens. The oomycetes are indiscriminate in what they infect. External infections typically result in systemic infections if left untreated. Oomycetes can also infect fish eggs. Infection can be associated with a variety of factors, including trauma, concurrent infection, crowding, poor water quality, and low temperatures. In regards to epidemiology, transmission is direct and indirect by way of motile zoospores. Another means of infection is via spoiled feed. All freshwater species are susceptible to infection. The oomycete can be identified on a skin scrape. Oomycetes are generally pathogens of aquatic organisms, including fish and amphibians. However, certain species can infect terrestrial vertebrates, like Pythium insidiosum, which can infect dogs and horses. Aphanomyces invadens is a species of oomycete that causes ulcerative dermatitis in tropical fish. The condition is known as epizootic ulcerative syndrome, and it's considered to be an immediately notifiable disease. The image on the right illustrates the cotton-like growth of oomycetes. Clinical signs associated with saprolegniasis include lethargy and respiratory distress. On gross examination, external infections are characterized by patches of cotton-like growth with associated ulceration of the skin. Systemic infections are associated with scattered foci of tissue necrosis. Histologically, you'll see large numbers of intralesional hyphae and oogonia associated with hemorrhage, necrosis, and granulomatous inflammation. Within sections of the kidney, there are scattered hypha-like organisms labeled in red. These structures are associated with marked histiocytic to granulomatous inflammation, replacing the hematopoietic tissue within the affected area. Phaeohyphomycosis is the disease associated with pigmented fungal infections. Species include Acanthocephala, Aquaculture, and Phoma. Pigmented fungi are opportunistic pathogens. Fungal hyphae have a tropism for vessels, given their affinity for the blood within, but in general they're fairly indiscriminate. External infections typically progress to systemic infections. Fish can also develop infections of the swim bladder via aspiration. Predisposing factors include trauma and concurrent infection as a result of immunosuppression. In regards to epidemiology, transmission is either direct or indirect. Infection can also occur with spoiled feed, particularly in fish with physostomous swim bladders. All species are susceptible to pigmented fungi in both the freshwater and the marine environment. Younger fish are particularly predisposed. Ancillary testing includes fungal culture. The images to the right are illustrations of the fungus on gross and histological examination. Note the dark pigmentation. For this reason, infected tissues will often look black. Clinical signs associated with infection include abnormal behavior and lethargy. Examples of abnormal behavior include abnormal swimming patterns and disequilibrium. On gross examination, you'll often find dark patchy lesions within the affected tissues. Other lesions may include disfigurement, especially in chronic infections. Histologically, you'll find large numbers of intralesional pigmented fungal hyphae, which are associated with granulomatous inflammation, necrosis, and vasculitis. Vasculitis may be associated with hemorrhage and thrombosis. Within sections of the kidney, there's an extensive area of necrosis and tissue loss. This is highlighted in red. On closer examination, there are large numbers of pigmented fungal hyphae within renal tubules and scattered throughout the renal interstitium. Fungal hyphae are labeled in red. The infection is associated with necrosis and granulomatous inflammation. In this section, fungal hyphae can be seen boring through the vessel wall, resulting in vasculitis with associated thrombosis and endothelial hypertrophy. The damaged vessel wall is highlighted in red. Within sections of the spongy ventricle, there are foci of granulomatous endocarditis with intralesional fungal hyphae. These are labeled in red. Dermocystidium salmonis is the agent responsible for dermocystidiosis. This is a mesomycetozoan. It's a primary pathogen with a tropism for the lamellar epithelium and the epidermis. In cases of systemic infections, it can affect any of the viscera. In regards to epidemiology, transmission is either direct or indirect. Transmission occurs via the zoospore. Once the host is infected, a tissue cyst will form. Epizootics are associated with significant mortality. Various freshwater species are susceptible. Ancillary testing includes 18S ribosomal DNA PCR. The image on the bottom right illustrates the life cycle of this pathogen. Once the zoospore infects the host, the parasite forms a tissue cyst, and through a series of replications, additional zoospores are produced, which are then released into the environment. The tissue cyst is referred to as a sporocyst, and it contains large numbers of hypnospores. Clinical signs associated with the disease include respiratory distress. On gross examination, there are large numbers of tissue cysts within the gills. Tissue cysts are up to 1 millimeter in diameter, and so they're visible with the naked eye. Histologically, you'll see large numbers of sporocysts containing hypnospores. Lesions include pleocellular to granulomatous inflammation of the skin and gills. Inflammation is often associated with epithelial hyperplasia. In the image to the right, you can see large numbers of tissue cysts within the gill filaments. Within sections of the skin, there are multiple sporocysts within the epidermis. These are labeled in red. The sporocysts are associated with dermatitis and epidermal hyperplasia. On closer examination, the sporocyst contains large numbers of hypnospores. Ichthyophonus hoferi is the agent responsible for Ichthyophonyiasis. This is a mesomycetozoan. Ichthyophonus is an opportunistic pathogen with a tropism for the skin. Gastrointestinal infections can also occur via ingestion. This will result in a systemic infection with a predilection for the heart. In regards to epidemiology, transmission is either direct or indirect. The organism has multiple life stages. The spore is the infective stage. This is generally ingested. The amoeboblast is the stage that occurs within the gastrointestinal tract. This is the stage that typically bores through the wall of the intestine. The pseudohyphae typically form within the viscera. Epizootics are associated with significant mortality. Various species of fish in the freshwater and marine environment are susceptible to infection. Ancillary testing includes PCR. Clinical signs associated with infection include abnormal behavior and reduced stamina. Examples of abnormal behavior include whirling and spiraling. On gross examination, you'll likely see large numbers of pale miliary nodules in a variety of tissues, particularly within the heart. This is a multisystemic disease, so in histological section you'll likely find scattered foci of necrosis and granulomatous inflammation within a variety of tissues. Areas of inflammation are associated with large numbers of intralesional spores, some of which may be forming pseudohyphae. Within various tissues, there are large numbers of pale yellow pigmented foci disrupting the normal tissue architecture. These are labeled in red. On closer examination, you'll notice that most of these spores are degenerate and have been infiltrated by macrophages. The macrophages contain cytoplasmic accumulations of pigment and cellular debris. Each spore is cuffed by a fibrous capsule. This is labeled in red. Sanguinicola is a blood fluke belonging to the group Digenea. This is a parasitic helminth. The adults live within the heart and major vessels. The eggs are released into circulation. This results in embolization, vascular rupture, inflammation, thrombosis, and ischemic necrosis. The gills are especially prone to embolization. In regards to epidemiology, the parasite has a complex life cycle, with fish serving as the definitive host, and snails and polychaetes serving as the intermediate hosts. Various species of fish in the marine environment are susceptible to infection. The image on the right illustrates the various life stages of the parasite, with the adult on the left and the egg and the myristidia on the right. There are no obvious clinical signs associated with infection. On gross examination, the gill tips are thickened and there may be excess mucus production. Histologically, there are large numbers of trematode eggs wedged within vessels throughout the gills. Embolization is associated with lymphohistiocytic to granulomatous filament bronchitis. There's also lamellar epithelial hyperplasia with associated lamellar fusion. Within sections of the gills, there are large numbers of trematode eggs embedded within vessels throughout the filament. These are labeled in red. The eggs are associated with chronic inflammation and lamellar epithelial hyperplasia. On closer examination, there is a developing trematode egg causing vascular obstruction. This is labeled in red. There's also evidence of thrombosis within the affected vessel. This is labeled in green. In this image, development of the myristidia is nearing completion. This is evident given the presence of distinct anatomic structures and a ciliated integument. Dactylogyrus is a gill fluke of the phylum Monogenea. This is a helminthic parasite that feeds on mucus and cellular debris. It has a tropism for gill filaments, though it also affects the epidermis to a lesser extent. Outbreaks are associated with overcrowding and poor water quality. The opisthapter is a unique anatomic feature of Monogenea. The parasite uses the opisthapter to anchor itself to the host. In so doing, it causes tissue injury, which can result in secondary bacterial infection. In regards to epidemiology, the parasite has a direct life cycle. Adults are oviparous. The eggs hatch and release oncomyristidia, which infect other hosts. Epizootics are associated with unfavorable conditions. Various species of freshwater fish are susceptible to infection. Ancillary testing includes gill clips and skin scrapes. Clinical signs associated with infection include abnormal behavior and hyperventilation. Examples of abnormal behavior include flashing and rubbing, which is characteristic of parasitic infection. On gross examination, the gill filaments are thickened. There's also excess mucus production. Histologically, there's widespread filament bronchitis, with associated lamellar epithelial hyperplasia and lamellar fusion. The images to the right are examples of histological sections and gill clips, demonstrating the parasite in situ. Gyrodactylus salaris is a similar species of monogenea. However, Gyrodactylus is a skin fluke, and it's an immediately notifiable disease. As far as pathogenesis, it's a helminthic parasite that feeds on tissue fluid. It has a tropism for the epidermis, though it can also infect the gill filaments. After latching onto the host, it releases proteolytic enzymes which cause extensive tissue injury. This can be associated with secondary infection. In regards to epidemiology, the parasite has a direct life cycle. The adults are viviparous, which means that they're live bearers as opposed to egg layers. This is primarily a disease of salmonids in the freshwater environment. Young fish are particularly susceptible. Ancillary testing includes skin scrapes and gill clips. In order to distinguish between Gyrodactylus and Dactylogyrus, you need to examine the reproductive system. Gyrodactylus is viviparous, so you'll likely find developing larvae, whereas Dactylogyrus is oviparous, so you'll likely find eggs. You can also look at the head. Dactylogyrus has 4 eye spots, whereas Gyrodactylus is blind. Clinical signs associated with infection include abnormal behavior, like flashing and rubbing. On gross examination, lesions include skin ulcers and excess mucus production. Histologically, lesions include ulcerative dermatitis and epidermal hyperplasia. In the image to the right, you can see large numbers of structures that resemble rice grains. These are the adult stages of Gyrodactylus. Clouding of the cornea is evidence of corneal epithelial injury as a result of the infection. This is a transmission electron micrograph of Gyrodactylus. Notice the large defect in the epithelium. This is the result of proteolytic enzyme secretion. Piscicola is a genus within Hirudinea, more commonly known as leeches. Specific species include Piscicola salmositica and Piscicola geometra. As with all other leeches, these are helminthic parasites that feed on blood, with a tropism for the skin. The parasite is rarely associated with significant pathology. It can, however, transmit blood parasites and viruses. It's also a general indicator of underlying disease. In regards to epidemiology, it has a direct life cycle. The adults are oviparous and require several blood meals before creating a batch of eggs. Epizootics typically occur in earthen ponds. Various species of fish in the freshwater environment are susceptible to infection, including salmonids when they migrate upriver to spawn. Clinical signs in fish with heavy parasite loads include lethargy and anemia. On gross examination, tissue pallor is a common finding in anemic fish. The site of attachment may also be associated with epidermal ulceration. This can progress to secondary bacterial infection. Histologically, the site of attachment is characterized by ulcerative dermatitis. The image on the top right is an example of a heavy parasite load. It's likely that this fish had some sort of underlying disease. If you remember your lessons in parasitology, the distribution of parasites within the population is uneven, where the vast majority of individuals have small numbers of parasites, and a handful of individuals have a heavy parasite load. Diplostomum spathaceum is another member of the group Digenea. This is more commonly known as the eye fluke. It's a helminthic parasite that has a tropism for the lens. Increased rates of infection typically occur when there's elevated temperature. In regards to epidemiology, the parasite has a complex life cycle. The definitive host is a piscivorous bird. The first intermediate host is the pond snail. The second intermediate host is the fish. Various species of fish within the freshwater environment are susceptible to infection, particularly cyprinids and the rainbow trout. Clinical signs associated with infection include blindness and reduced growth. On gross examination, lesions include lens cataracts and emaciation. Histologically, within sections of the lens, there are frequent balloon cells and Morgagnian globules. This is evidence of lenticular degeneration. There's also an associated lens epithelial hyperplasia. The image on the bottom right is the cercaria, which is the infective stage for the fish. The image on the top right is a photograph of the lens showing all the encysted metacercaria. Within this collection of images, there are large numbers of metacercaria embedded within the various structures of the eye, including the retina and the lens. The image on the bottom right is an example of a lens cataract on gross examination. Acanthocephala is a group of intestinal parasites, more commonly known as the thorny-headed worms. Species of significance in fish include Echinorinchus and Neoechinorinchus. As previously mentioned, this is a helminthic parasite that has a tropism for the intestine. It has a spiny proboscis which it uses as a holdfast. This can cause significant injury of the intestinal mucosa, resulting in secondary infection. In regards to epidemiology, the parasite has a complex life cycle. Fish typically serve as the definitive host, whereas the crustacean serves as the intermediate host. Epizootics typically occur in hatcheries. Various species of fish in both the freshwater and marine environment are susceptible to infection. Younger fish are particularly predisposed. Clinical signs associated with infection include reduced growth. On gross examination, there are large numbers of intraluminal acanthocephalans. The affected mucosa may be hyperemic. Histologically, the infection is associated with pleocellular enteritis. Other lesions at the site of attachment include necrosis of the mucosal epithelium and mucosal hyperplasia. The image on the bottom right is an example of a heavy parasite load within the lumen of the intestine. Within the section of the intestine, there is an acanthocephalan embedded within the intestinal wall, causing ulceration and transmural inflammation. This could progress to intestinal rupture. Lepeophtheirus salmonis is more commonly known as the salmon louse. It's a member of Copepoda of Caligidae. In regards to pathogenesis, it has a tropism for the epidermis. It uses its maxillipeds to latch onto the host, and then it uses its rasping mouthparts to feed on mucus, epidermis, and tissue. This pattern of feeding can result in epidermal ulceration, which can lead to anemia, ionic imbalances, and secondary bacterial infection. It's worth noting that the Pacific salmon louse is less pathogenic than the Atlantic salmon louse, even though they're the same species. In regards to its epidemiology, it has a multi-stage life cycle. Transmission is both direct and indirect via planktonic larvae. Epizootics occur in open net pens. All salmonids within the marine environment are susceptible to infection. However, young fish are especially predisposed. The image to the right is a scanning electron micrograph of the mouthparts of the salmon louse. This is a diagram of the life cycle of the salmon louse. Life begins with the nauplius larvae, which emerge from the eggs that are shed into the environment. These larvae are planktonic, so they're carried some distance by way of winds and currents. Eventually, they metamorphose into the copepodid, which is the infective stage. Upon finding a suitable host, they latch onto the skin, at which point they enter the calamus stage. This stage is non-motile, as they're firmly adhered to the skin via modified mouthparts. After a series of molts in the calamus stage, they change into pre-adults, which are motile. At this stage, they're able to move around the fish or jump onto other fish. As they mature into adults, they mate, at which point the female will develop a pair of egg sacs. The eggs are then shed into the environment, thereby completing the life cycle. Clinical signs associated with infection include reduced feed conversion, reduced growth, and inhabitants. On gross examination, there's excess mucus production. There's scattered foci of epidermal ulceration and exposed fin rays. Histologically, the infected area is characterized by ulcerative dermatitis with tissue necrosis and secondary bacterial infection. The image on the right is a severe case of epidermal ulceration as a result of salmon louse infection. One of the issues with open net pen salmon farming is how the presence of a permanent population of adult salmon within the nearshore environment can interfere with the transmission cycle of the salmon louse. Young Pacific salmon and farmed Atlantic salmon are free of lice upon entering the marine environment. Adult Pacific salmon migrate towards the coast and upriver to spawn. Lice from the adult Pacific salmon infect the farmed Atlantic salmon in the marine net pens. Once the adult Pacific salmon enter fresh water, the remaining lice fall off and die. The young Pacific salmon are infected by the farmed Atlantic salmon during the outmigration between March and June. The high population density of salmon farms allows for efficient transmission. This is the result of an increased parasite load on the farm and the surrounding environment. There's also continued production of the infectious stage, wherein several generations can occur per year. The growth of the salmon louse population is dependent on a number of factors. Increased growth typically occurs with elevated temperature and a higher salinity. Reduced growth typically occurs with freshwater runoff as it results in a lower salinity. Negative growth occurs when the population is treated or when the salmon are removed. Lernia is a genus of parasitic copepod within Arthropoda. These are more commonly known as anchorworms. The tropism of the parasite will vary depending on the life stage. Adult females typically infect the gills and the skin. The larva will typically latch onto the gills. The adults are equipped with a spiny anchor, which serves as a holdfast. This causes significant tissue injury and may progress to secondary infection. In regards to epidemiology, the parasite has a multi-stage life cycle. Transmission is direct or indirect via planktonic larvae. Epizootics are typically associated with aquaculture and can result in significant mortality. Various species of freshwater fish are susceptible to infection, particularly the cyprinids. Younger fish are predisposed. Adult females are easily recognized on gross examination. However, gill clips can be used to identify the larva prior to maturation. The image on the right is a diagram illustrating the various life stages of Lernia. Clinical signs associated with gill infections include respiratory distress. On gross examination, the adults are easily identified as they're anchored to the skin or the gills. Sites of anchorage are associated with hemorrhage. The larva can be seen clasping to the gill filaments. Histologically, there's localized trauma at the site of attachment. Trauma is characterized by hemorrhage, necrosis, and inflammation. The inflammatory infiltrate is lymphohistiocytic with an abundance of eosinophilic granular cells. In chronic infections, the epithelium at the site of attachment may be hyperplastic. There can also be significant fibrosis around the holdfast. The images to the right are examples of the adult female after latching onto the host with a spiny anchor. You'll notice the paired egg sacs hanging off the caudal end. You can also see a focus of hemorrhage at the site of attachment. Sebekia is a genus of parasitic arthropod of the group Pentastomida, and it's responsible for the disease known as Pentastomycosis. Pentastomida is a group of parasites that most people aren't too familiar with because it's more common among lower vertebrates like fish, amphibians, and reptiles. In fish, the parasite has a tropism for the body wall, the mesentery, and the viscera. In regards to its epidemiology, the parasite has a complex life cycle. Reptiles typically serve as the definitive host, whereas fish serve as the intermediate host. There are various species of fish in the freshwater environment that can serve as the intermediate host. Examples include swordtails, mollies, guppies, and platies. All of these fish belong to the same family, Posilidae, and are collectively known as the live bearers because of their ovoviviparous reproductive strategy. Clinical signs associated with infection include migrating and tegumentary swellings. On gross examination, common lesions include pale nodules which are scattered throughout the mesentery and viscera. You'll also find areas of trauma, which represent parasite migration tracts. Histologically, affected tissues will have intralesional pentastomid nymphs, within areas of hemorrhage and granulomatous inflammation. In chronic infections, the parasite will be surrounded by a fibrous capsule. The image on the top right is a micrograph of a pentastomid nymph. The image on the bottom is a close-up of the abdomen of an infected fish. You'll notice all the coiled parasites within the coelomic cavity. This is a sagittal section of an entire fish. Within the uterus, you'll notice that there are large numbers of developing embryos. These are labeled in green. Within the peritoneal cavity, there are large numbers of parasitic arthropods, which are morphologically consistent with pentastomes. These are labeled in red. A characteristic feature to help you distinguish between arthropods and other helminthic parasites is the presence of skeletal muscle and jointed appendages.